What happens to your identity and sense of purpose when your plan for the next 40 years is wiped off the table? What makes life worth living in the face of death? Paul Kalanithi, in his 6th year of neurosurgical residency at Stanford University, sits in front of the hospital computer examining CT scans. He sees lungs matted with tumors, spine deformed, a full lobe of liver obliterated, cancer widely disseminated. He says, "I have seen scores of such CT scans, but this one is different. This is my own." Paul was 36 years of age at that time. This book, When Breath Becomes Air, is an autobiographical memoir written by Paul Kalanithi. In this memoir, he talks about his life and his battling stage 4 lung cancer. This book made a huge splash and became the #1 book in the New York Times bestsellers non-fiction category in 2016 when it was published posthumously. Paul Kalanithi was born in New York. His mother introduced him to book reading at a young age to educate his mind, and he fell in love with English literature. As he grew, he did his master's in English literature, history, and philosophy. His desire to understand the meaning of life drew him to the study of medicine. At Yale University, he met Lucy, his future wife. After his medical studies, Kalanithi joined as a neurosurgical resident at Stanford University. In his 6th year, he returned to hospital duties and achieved professional recognition. He felt that finally he found his place in this world. Little did he know what was in store for him. In his final year of residency, Kalanithi felt that his health was declining. Rapid weight loss and severe pain in the back and chest caused a lot of concern to him and his wife. His early x-rays appeared to be normal, and Kalanithi attributed the symptoms to work overload. However, the symptoms came back stronger. Kalanithi's life took an unexpected turn when further tests confirmed that he suffered from stage 4 lung cancer. Kalanithi started treatment with Dr. Emma Hayward, an expert in the field of oncology. Being a doctor himself, it was difficult for him to take a step back and accept the professional help offered. It is said that doctors make the worst patients. Kalanithi's parents helped him transition from a doctor to a patient. With improved health, the couple decided to have a baby. When Kalanithi found his health improving, he returned to the operation theatre, for that was his passion, but he could not complete the operation as he was unable to take the strain. Soon his condition worsened and he had to resort to chemotherapy, though it did not prove to be of much help. Kalanithi was overjoyed when his daughter was born, but he could not attend the graduation as his health deteriorated further. On bad days, Kalanithi went back to reading English literature and found some solace in reading poetry. Though the treatments prolonged his life by a year, Kalanithi died in the ICU of the hospital. Viewers, the epilogue of this book has been written by his wife, Lucy. She talks about his final months. The two had become inseparable after Emma Hayward had given an approximation of the time that he had left. Lucy recounts how on one particular night she had asked Kalanithi if he was able to breathe comfortably as she had her head on his chest. And Kalanithi had replied, "This is the only way I know how to breathe." According to Lucy, what happened to Kalanithi was tragic. He was not a tragedy. Readers, this book is proof that it is the dying who have the most to teach us about life. When Breath Becomes Air gives the readers a new perspective on mortality and how to live life when breath is still breath. I recommend this book to anyone and everyone. Thank you.